Good afternoon, everyone. Thank you for joining us here today for our webinar on surgical services strategy. Looks like we have a great group of people here together today, so we look forward to an engaging conversation. You can notice on the side we have the chat feature enabled. Please feel free if you have questions or comments throughout the webinar to enter them in there. And then towards the end of the presentation, we'll have a Q&A session to further explain or elaborate on any points that you guys are interested in or any other points that you'd like to bring up. Looks like we're waiting on a few more people. We'll give it just a few more minutes and appreciate your time and look forward to a great conversation. Thank you. All right, and without further ado, I'll turn the presentation over to Tom Guglielmo, our healthcare partner, who is in charge of our healthcare practice. Look forward to it. Take it away, Tom.
All right. Good afternoon, everybody. Thanks again for joining us today for this webinar. I think it'll be very educational for you. I look forward to presenting to you and obviously answering any questions towards the end of the presentation. So I'll go ahead and get started. Just wanted to start with, hold on a sec, I have a little bit of a delay here. Okay, here we go. I just wanted to introduce Tefen to start out. I'm just going to give you a couple of slides on this, so just bear with me. And Tefen is a global management consulting firm, and really what we do is we help senior executives from multiple industries develop strategies, implement change, and generate value. The industries that we focus on are healthcare, obviously, as you can see from some of our recent healthcare clients. Also, we work in the biotech, pharmaceutical, med device, and semiconductor manufacturing industry. So we're taking principles from other industries as well as from healthcare and applying these. So as far as a little bit more about Tefen, we've been in business for 28 years. So we've been around for a while. We've worked with a lot of the Fortune 500 companies out there from all sectors. And you can see from this slide here just a couple of examples of outside of healthcare, other areas that we've worked in and other companies that we've worked in. Okay, a little bit about our service offerings. You can see, I'm not going to read all this to you, but it's a combination of the four areas: strategy, operations excellence, project management, and organizational development. And specifically within healthcare, we pretty much cover all the areas within healthcare, corporate and hospital level, as well as departmental level. So you can see we've done a lot of work in pretty much all the spaces within the...
Hey, Darius, Jim Lee.
Hello?
Pretty good. Yourself?
Okay.
Oh, no, I figured as much. But I asked, I was wondering if there's a, capital request for a new one.
Hey, is everybody hearing that conversation?
Yes. Yes.
I don't know what that is, but...
Yes.
Yeah, it seems as though I think one of the participants has another line patched in through, so hopefully he'll recognize that and switch out, but I think we should be okay.
Okay. All right, so I'll continue. All right, so let's get into the presentation, and today I'll be talking about surgical services strategy. So the first thing is what are some of the challenges? I think the first thing, one of the things I've heard a lot is, we're trying to be everything to everyone, so we're offering surgeries in all the different categories, and, is that really the best plan to move forward? Some of the other challenges that we see are lack of data, so it's really difficult to express, where should we be? Also looking at lacking suitable tools that align your strategic plan so that you actually have the information to make clear decisions. And also the external unknowns. What about our competition? Are we looking at our competition and what they're doing? What are our strengths and weaknesses? And then lack of knowledge in terms of effective project management capabilities. Okay, I think we find that all over. And also from a physician side, what are our physicians looking to do? What are the strengths and weaknesses of our physician staff? Now, how do we actually overcome those challenges? Well, it's a number of ways. You've got data observation, collection, and analytical skills. One of the things that you really need to look at is that bottom-up analytical. So what is your data telling you? And really listen to that data. Also, use of decision support tools to align criteria and stakeholders to really help make those decisions. And I'll show you an example of a tool that we use called Expert Choice, and we use that in a number of ways. And then alignment of strategic and operational tools to equip your workforce for sustained action. And I'll introduce some of those as well. And then finally, change leadership and implementation plans with clear milestones to achieve those goals. And that really gets to the project management component of it. So analyzing your portfolio, okay, there's 4 main quadrants, as you can see. We've got the A, B, C, D. And along the y-axis, you've got your case volume. Along the x-axis, that's your direct margin per OR minute, or you can also look at it by case. Now, when you plot the different services from the surgical services area in these 4 quadrants, you're basically going to come out with quadrant A, what we're calling the stars. So that's where we're doing a lot of case volume, and we have a high direct margin. Okay, quadrant B is an area for investment. So that's an area where we have direct margin, but our case volume is low. That's an area we want to invest. How do we get our case volume to increase so that we can take advantage of that high margin? Quadrant C would be areas where you have low volume and low margin. So areas where you might want to consider divesting. Maybe that's not a space we want to focus on. And then finally in quadrant D, you've got your area of efficiency. So area where we're doing a lot of volume, however, our margins are low. So what can we do to help increase that margin? There might be some efficiency tools that we can implement, and I'll cover some of those in a little bit. So here's an example of, you can see that same exercise that I just talked about with actual data behind it. So you can see your A, B, C's, and D's. So in this example, obviously orthopedics and general surgery would be, for my hospital, the area of my, what I call the stars. And then you can obviously look at the other 3 quadrants to see, where we're doing well, where we're not doing so well. So gynecology, doing a lot of volume, there's an opportunity to push that over to the right. What can we do from an efficiency standpoint? Bottom left quadrant, ophthalmology, neurosurgery, plastics. Do we want to continue to focus in those areas? So another tool that we like to use as part of this is called the 3 C's analysis. So when we're looking at areas that we want to focus on, there's also some other components that you need to look at. Number 1 is our actual hospital, which in this case is the company. So what are our core competencies? What are the key success factors that we require to deliver what the patients want? Also looking at the patient, represented by the customer box. Who are the target segments? What are the patients seeking? And what benefits do they want? And then finally, competition. Okay, what are their target segments? What are their focuses? What can we do to differentiate ourselves from our competition? So really linking the 3 of these is important, is another important tool when looking at the quadrant. So as much as we want to have all of our services within the A quadrant, it might not be possible depending on some of these other components. So when we look at the 4 quadrants, okay, in order to move our direct margin, which is the x-axis, that's really competency-driven, and I'll talk a little bit more about that. And then finally, on the case volume, that's more customer-driven. How do we get more cases? I mean, it's not just that, okay, yes, we want to increase our volume, but how do we do that? So in order to move to the right, it's really about the efficiency, and then, of course, going up is about the volume, and how do we go about doing that? So from a customer standpoint, some different options that you can consider to try and drive up that volume is adding physicians, okay? Looking for, recruiting other physicians to bring in some of the capabilities to increase the volume of those high profitable areas. Also, how do we attract new patients? We can look within the current population, the demographic that we have. How can we bring new customers over? What can we do as a hospital to either market that or make changes to our current operation? Mapping clinical pathways to retain customers, so understanding disease progression, developing customer marketing retention strategies, understanding the local community and what they're looking for. And then finally, differentiation strategy or centers of excellence. So developing these centers of excellence, like I showed in the example earlier, orthopedics, maybe that's the area that we should focus on. We want to be the best in the area when it comes to orthopedics. When you look at competency-driven, this gets into the efficiency piece. So OR key levers, how do we increase our availability? How do we improve capacity? How do we balance between inpatient and outpatient? What's the case mix? What does the case mix look like? from a revenue collection standpoint, ensuring that we're capturing all the revenue possible. And then also key success factor adherence. So adherence to those success factors over that 5-year period that we have, our strategic planning process, is that aligned with our metrics. And then finally, resources and assets. Do we have the right resources to actually make this happen? Okay, aligning our quality indicators. Obviously, core measures are a big component today. Aligning to those key operational factors, length of stay, on-time starts. Okay, making sure we're doing the right things so that we have the capacity to bring in that additional volume. So 4 key strategic levers when you're looking at how do we move forward. So you've got site-specific versus system-wide. Okay, do we have something that we could do at a site versus do we need to necessarily do it at the system level? Looking at your IT systems and your patient database, really that's the knowledge management component. Leadership. So what is is the leadership aligned? Is there good communication? And do we have a vision and a clear goal for the organization to move forward? And then finally, do we have a clear strategic plan? Okay, that's very important. And then the 4 key operational levers. Okay, there's efficiency, which impacts your OR minutes available. Then there's the availability, so that's impacting your volume. Then there's that balance, as I said, between outpatient and inpatient. So, can we move some of the surgeries that we're doing in our inpatient unit to the outpatient to create more availability? And then finally, the case mix, which will actually impact our overall strategy and revenue. And we'll show you a little bit, a couple of models here shortly that take into consideration our case mix. So when you look at efficiency in the current state, this is just an example of a dashboard. You can see that, it's looking at first case on-time starts and, what the room turnaround should be. So for the efficiency lever, we really want to look at patient pre-admission testing completeness. Are we getting all of what we need to get done prior to the day of surgery, which will obviously impact our on-time starts? How are our turnaround times? What are the reasons for our delays? And then scheduled versus actual time. Are we actually adhering to what we're scheduled? All right, so these are all components that impact the efficiency and the operation of the surgical services unit. So just some examples. Okay, this is on-time start, of course. This is an analysis that is really important to look at. I'm not going to go into the details of each chart, but it's really more for example purposes. You can see that the impact of if we're able to improve a certain percentage, what that's going to mean to our capacity. And you can see it's going to be different by day of week. Unfortunately, it'd be nice if we could have the same volume going Monday through Friday, but as you know, that's not realistic. So there might be certain days of the week that are more problematic than others. This is also taking it to another level. So looking at on-time start by surgeon and by service line. We might be, overall, at say 80%, but there might be certain positions that are much lower than that. There might be certain service lines that are also lower than that we want to focus on. Okay, waiting time. So this is looking at how much time is the patient waiting in the room before the surgery starts. In some cases, you have patient in room. That might be your metric. You may be doing a really good job at that, but the surgery may start 30 minutes after the patient's in the room. So technically, we're really starting on time. It really depends on how you measure that. I think that's another question to ask is, how do you measure on-time start? I've seen a lot of different ways. There's patient in room with, 15-minute grace. There's cut time. It's really all over the place. But, our belief is that cut time is really the true on-time start. Okay. Here we're looking at your scheduled time versus your actual time. So again, if we're scheduling 2 hours for the procedure, are we taking 2 hours? Are we taking 1 hour? Are we taking 3 hours? What's the variability within that service? And, that's really important to track. I know that most hospitals do a good job of actually looking at this, but, again, you're only looking at the last 10 cases and making a determination from that. So trying to reduce some of that variation in the schedule versus actual is critical to increasing your efficiency and opening up capacity. All right, so just another case of another, looking at it by surgeon, as far as the schedule versus actual, which is usually the way to go about it because, in some cases, you always have a few guilty parties that may not be doing as well as others. All right. Now, availability. So hours of operation is also another consideration. If we're keeping our ORs from 7:30 to 5, are we actually utilizing all of that time? So looking at the analysis and balancing, do we need to open up additional ORs in the afternoon? Do we need to shut down some additional ORs after a certain period? And do we need to open up some more time on the weekend? So by creating these different models, you can see where your gaps are and where your opportunity is. That way you're aligning your cost structure with your demand. Okay, capacity. So again, looking at your utilization by day of week, looking at it by OR. Are we maximizing our potential with the existing space? Okay, very important. Okay, again, block utilization. So I think I've only come across one hospital that doesn't use block time. So for the most part, block utilization is usually a big component. Most hospitals are probably blocking off 80% plus of their time. Are we actually utilizing those blocks? Do we have policies in place to, monitor the different physicians and physician groups and make sure that they're using that allocated time? Again, very important to look at. Cancellations. In some cases we've got hospitals that have a lot of cancellations, and unfortunately when you cancel that time, and depending on when it's canceled, in this example you can see they had a lot of cancellations within 3 days. Very difficult to actually go back and reutilize that time. So technically that's going to be lost time in most cases. Okay, then case booking. So when are we actually booking the cases? Are we doing it within 0 to 3 days versus much further in advance? This is again a scheduling function, it's discipline. How can we schedule better and get better visibility as to what the capacity is going to be required, what staff we need to have in place, etc. Okay, so what I want to talk about now is case mix modeling. So how do I actually model proposed changes to my efficiency and volume? So for example, if I wanted to change my case mix, okay, that's fine. I think that's pretty straightforward. You can look at the actual times that it takes to complete those cases. How are we performing in the current state? But the question is, if we apply those efficiency tools that I just went through, what does that do to impact our case mix? If I change my case mix, how much extra utilization do I have by reducing my turnaround times, by improving my on-time starts? So this is an example of a model that we've developed which actually helps you do that. So the areas that you see in yellow, those are areas that can be changed. So, if you have changes in your turnaround time, what does that mean as far as utilization goes and capacity goes? If I change my case mix, if I change the duration of that surgery, so how does that all impact my overall capacity and utilization? And that's what this model does. It gives you some different scenarios. You can put in hours of operation, how many ORs do I have open, hours of time, and really gives you a good picture of the impact of these improvements that we make. Okay, and then this is just an example you can see of the typical ROI benefit from working through those efficiency changes as well as the changes in case mix. So this takes into consideration case mix availability and efficiency. As you can see, over a short period of time, you can really take advantage of a lot of savings if you do all of these things correctly. In some cases, you may have certain areas you may be able to improve your efficiency without changing your case mix, and that might vary as far as what the savings looks like. But overall, you can see this is pretty impressive numbers. Okay, resources. So when we look at alignment to our capacity, there's a lot of different players within the surgical services operation. You've got as you can see along the bottom, your pre-admission testing through your post-anesthesia care. But also you have other components that are touching the performance of surgical services. Our ancillaries, or our turnaround times from those groups, are they holding up on-time starts? Materials management, do we have the right materials in the rooms at the right times when we need them? Do we have to run in and out of the room to grab things that should have already been there? Then you have central processing, of course. Are things being processed? Are instruments being turned around in time? Are the case cards accurate? So a lot of different components that can impact the overall operation of surgery. So this here is your strategic planning cycle. So when you look at there's really 4 steps here. You've got the identification component, okay, the what exactly do we want to focus on. Then the diagnosing piece, okay, so that's the internal assessment. What is our current performance? And then the 3, conceiving, what should be our option, okay, and then finally the realization. How do we realize those benefits? How do we track our key metrics? For the first stage, which is the identifying phase, we actually use a tool called Expert Choice. And what this is it's decision support software, which actually helps you to make decisions based on data as opposed to, just gut feel or anecdotes. And just a couple of examples of how Expert Choice works. The first thing you need to do is set your criteria. So if I was looking at, what areas do we want to be in for our, as far as our service lines, what should be our stars, our high volume, high margin areas? What do we want to create centers of excellence for? So we need to come up with some decision criteria. So once we set our criteria, you can see there's an example there on the right. We need to put some weightings to it. Okay, that helps us to define which components are more important than others. Then what happens is you go through the system and do what are called pairwise comparisons. So I'll compare, option 1 versus option 2 versus that criteria. And it's done based on a scale, as you can see from the red. It's something moderately more important, extremely more important. And you go through this exercise with all the different criteria and all of the different alternatives. And eventually you'll go ahead and get an output like this on the right, which will show you your prioritization. Okay, tools to use at stage 2. So this is the diagnosing stage. So there's a number of things that we do. There's SWOT, which is your strengths, weaknesses, opportunities, and threats analysis. KSF, which are your key success factors. And then finally, your competitor analysis. So you can see here, again, this is a recap. We talked about the 3 C's earlier. So doing the, what is the company, what are our core competencies, what are our customers looking for, and what is our competition doing? So making sure we understand these 3 components. All right. And then when you look at competitor analysis, who are the competitors? Okay, what are they doing? How are they doing it? Why are they doing it? What major developments do we expect? And then what are the implications for us? All right, this is an example. So this is your key success factors analysis. So when you look at what are the key success factors for our hospital, you can see on the left-hand side as an example, positive outcomes and high patient satisfaction, et cetera. And then putting a weight on what is that today versus what is that going to be in 5 years. And then what we do is we look at where are we as a hospital performing, that's column 4, and then what are our competitors doing. And then by looking at this, you can see where do we need to really invest our effort and our resources in order to improve in these different areas. Okay, SWOT analysis. So this is another quadrant that you can see. Many of you have probably gone through these exercises somewhere or another, but it's really identifying these 4 areas. And as you can see, in the strengths and opportunities, those are going to be the things that are helpful to achieving our objectives. The weaknesses and threats, those are harmful. Those are going to be barriers to us achieving those objectives. And then across the left-hand side, you've got your internal and external origin, which the internal is made up of your strengths and weaknesses, and then your external are your opportunities and threats. So, again, another tool that helps us to determine what should be the ultimate focus of our hospital. And then this is an example of a SWOT analysis. So by going through this exercise, you can see what we're doing here is putting our different pluses and minuses and then totaling them up across the right and across the bottom to see what are the areas that we want to focus on. So you can see in the blue circles there, increasing emphasis on price competition, patients deferring elective surgeries. So this is just a short example of how we would apply SWOT. And then finally, on the strategic planning cycle, you've got stages 3 and 4, the conceiving and realizing stage. Again, this is really done through strategic workshops after we've completed tools 1 and 2. And you can see an example of a strategic workshop outcome. So this here is used as again, another tool to determine where are we scoring high, where are we scoring low, and another piece of information to help us make some decisions moving forward. So kind of to put this all together, this is essentially the strategic plan and modeling offering that we have. And you can see there's 4 phases to this prior to implementation. You've got the basis, so that's workshops to define what is our strategy, looking at the data preparation, so what is our current performance, what is our capacity, what is our case mix exactly looking like right now, and then stage 3 would move into the different workshops, so looking at SWOT analysis, key success factors, to determine where should we go to market, okay, what should be our decision, and then finally defining those actions and then getting into the implementation component of it. So that's the presentation component here. I went through that. I'd be happy to go back if anybody has any questions, but I'd like to open it up now to the group for a little Q&A based on what I just went through. And I'll just wait a few minutes and see if anyone has anything for me.
Tom, I have a couple of questions from the chat that were asked during the presentation. The first, how do you present the data to particular service lines or physicians, kind of the frequent offenders, if you would? How is that?
Yeah, so there's a number of ways that typically happens, but I think the most effective way that we've used is really through the chief of surgery or the chief medical officer, having that individual getting periodic reports, and if you have guilty parties, especially if there are multiple offenders, writing letters to that physician or physician group, is typically the most effective way. If it doesn't come from the leadership, usually it's not effective. I mean, to put nurses in a position where they have to scold physicians is usually not the best option.
Great. And the other question we had was the case mix modeling that you went over. Is that software based or is that based in some other program?
Yeah, that's actually an Excel-based tool that we developed, and again, it's customizable, and it's really dependent on the institution on what their case mix is. But as the example showed, it really allows you to change some of those inputs and then see what the impact of those changes will be on your overall capacity.
Great, thanks. Anything? Feel free, anyone else, to open up. That's all we had from the chat section of the presentation. All right. Well, we have recorded this webinar. It will be available, posted on our website, www.tefen.com. Thank you all so much for your time. And I don't know, Tom, if you're going to go to the next slide with your contact info, if you have any questions or other considerations.
We'll send out the presentation to the folks, and that way they can they'll have our contact info on there.
Great. Well, thank you all again, and have a great rest of your afternoon.